And the last one is stress. How many people would find this stressful? I would. I'm like, yeah. I remember walking over a bridge when I was in Mexico, and I was walking down the street, and it said, caution, crocodile crossing. I'm like, what? You gotta be kidding me. And that's what we have to walk over? So he doesn't find this very stressful, but it would be for most of us. The crocodile hunter, who passed away a few years ago, that was fun for him. But when it is stressful for us, chronic cortisol secretion can cause central obesity, hypertension, insulin resistance, dyslipidemia, blood clotting, which are all manifestations of metabolic syndrome. Stress response includes the activation of the sympathetic nervous system and stimulation of epinephrine and cortisol release. These hormones, over the long term, reduce insulin sensitivity and can cause central obesity. Very straightforward connection between stress and weight gain. All right, who wants to come up here and explain this chart? Okay, I'm not going to explain it much either, except just go through each of the systems. Stress can affect all the systems of the body. It can affect our brain chemistry. It can affect our blood sugar regulation. It affects our thyroid function. It also will affect hormone balance. Excess body fat has an enzyme called aromatase in it. Aromatase converts testosterone and androgens into estrogen, which can cause then thyroid dysfunction. And in the end, causes lower fat burning and more weight gain. That's the summary to that chart. That was provided by Dr. Bob Rakowski. And this is Dr. Jeffrey Bland's seminar series in 2002. He says, with prolonged stress, the individual becomes insulin resistant, recovery after an injury or illness decreases, libido and reproductive function are adversely affected, muscles start to lose tone, the body becomes fatter, blood cholesterol, triglycerides, and pressure increases, fatigue sets in and sleep is restless, mood slips towards depression, inflammatory conditions increase, immune defense decreases, and energy and enthusiasm for life are lost. All with chronic stress. Pretty much covers everything anybody would want to complain about, right?
Yeah, really.
I mean, if you took care of all those symptoms, I don't think they're all stress related, but I think stress is a very big factor in our health and weight today. But if you take all those away, you know, the healthcare system would probably go out of business overnight. When carbohydrate cravers were asked why they succumb to foods they know will exacerbate their obesity, they eat to combat tension, anxiety, and mental fatigue. We're just stressed out, so we reach for foods that make us feel good and lower the stress just a little bit. And if you think stress is a big factor, or even if you maybe a little bit think stress is a factor, but not a big one, you should probably have it tested. And here's why. I have a client, her testimonial is also on the website. Her name's Shelly. And she's seen a number of health professionals over the last 10 years, wasn't able to lose any weight, 10, maybe 15 pounds off and on. And I just said, we got to do some comprehensive testing because I don't think I know what's wrong with you. Sure enough, cortisol levels are off the charts, stress levels are off the charts. She ranks her stress a 5 or a 6 on a 1 to a 10 scale, 10 being super high. Well, I feel like I'm somewhat stressed, but I know I manage it really well. You know, if you ask one of my coworkers, they'd say, she's really stressed, but yet I don't feel it. She was feeling it. We addressed her stress. She's at over 50 pounds already in less than a year, or maybe it's right at a year. 50 pounds, seeing unbelievable results because we addressed the underlying metabolic challenge. So what do you do, right? We got all these things we're considering. Well, it is a complex condition. It has a number of environmental factors that are playing a role, including unbalanced dietary patterns and physical inactivity. But you need to get educated. You need to be able to start taking care of your own health, and that's a big one. And I think assessment's a big one. Only 12% of Americans are health literate at a level that allows them to manage their own care. The lack of literacy can negatively affect the quality of care a patient receives and cost the U.S. economy between 106 and 236 billion annually. People just don't know. And by the way, this literacy that they're talking about isn't what I would consider health literacy. This is your ability to read medication instructions, read labels, read your insurance coverage so that you know if you have, read pre-surgery or pre-op instructions. That's what they're talking about here. If you asked what should you be eating, how should you be exercising, it's going to be less than that, I'm sure. I don't recommend you go see your physician if you suspect any of these things. I recommend you first start with a health coach or somebody who can do a comprehensive assessment. And the reason why is the literature supports what I'm saying. The Journal of the American Medical Association says most physicians lack the time, information, technology, and financial incentives to develop organized processes to systematically improve the quality of care provided to patients with chronic disease. The Annals of Internal Medicine says primary care providers often feel ill-equipped to provide the lifestyle modification counseling to facilitate weight management. The Journal of the American Medical Association, the same journal as before, says there's a large gap between what physicians do for patients with chronic disease and what should be done. Fortunately, they don't have the tools, the know-how, it's not set up in the system. They're not the right people to typically go to see to handle these things we've talked about today. And here's Dr. Oz, Muhammad Oz, of the Oprah fame, and he's got his own show now, and Dr. Mark Hyman, who's the Ultra Metabolism, the Ultra Mind author, both MDs. And here's what they have to say about the healthcare system and the people you might want to go see relating to these issues. Here's Dr. Oz first.
I think it's probably the most straightforward way to improve the healthcare system is to build a culture of health advocates. Call them health coaches for now. I think frequently they probably should not be MDs, not because doctors can't do it, but it's probably not what doctors are passionate about doing usually. I mean, I went to medical school because I was curious about the physiology of the heart. I liked the tension, the exhilaration of being in an operating room. If you put me in charge of managing hypertension and a chronic ailment, I probably wouldn't do it as well. And studies done on this topic have demonstrated that nurse practitioners will often manage chronic illnesses more effectively for that reason. They love doing it. That's what they get up in the morning thinking about. So I think my brethren within medicine don't see that as a threat. It's a physician extender. You're helping me.
So just to summarize what he says is the most straightforward way of improving the healthcare system is to train a group of health coaches, or call them health coaches, who can help manage people's lifestyles and these chronic conditions, because physicians like he, although he's a surgeon, and most just aren't trained that way. It's not what they get up and think about in the morning. It is what I get up and think about in the morning. So that's what most health coaches and people like me do get up and think about in the morning. Here is Dr. Mark Hyman talking about first-line therapy, which all you are familiar with now.
I would just emphasize the whole aspect of health coaching. I think the things that Dean has done for almost 2 decades, training teams of people to work together, and what the Health Corps does, has been also amplified with other programs that are existing. For example, like first-line therapy, based on the NIH recommendations for therapeutic lifestyle changes, already trained 12,000 lifestyle educators in over 7 years in 50 states that are implementing this program, and they are able to do this within doctors' offices and practitioners. But there's no model for reimbursement. There are actually practitioners who are sending their staff to go get trained in this so they can be lifestyle educators, and they're sucking up the cost from their practices. They believe in this, and I think
so that was a Senate hearing committee at the federal government about how to integrate alternative medicine or care into the mainstream medical community. And I am one of those 12,000 people that have been trained in FLT. That's what I'm certified in as well. But this stuff's starting to take hold. So the things that you're learning in this class, in this program, they're cutting edge. They really are. And lifestyle medicine, this is the article that I printed off for you guys and gave to you. And written by Dr. Dean Ornish and Dr. Mark Hyman and a couple others. Most of the chronic diseases that affect 160 million Americans account for 78% of our healthcare costs and are caused by lifestyle and environmental factors, namely our diet, sedentary lifestyle, smoking, stress, and environmental toxins. Lifestyle medicine is not just about preventing chronic disease, but also about treating it, often more effectively and less expensively than relying on drugs and surgery. Nearly all the major medical societies recently joined in publishing a review of the scientific evidence for lifestyle medicine for both the prevention and treatment of chronic disease. There is strong evidence that this approach works and saves money. Unfortunately, insurance doesn't pay for it. No one profits from lifestyle medicine. So it's not part of medical education or practice. It should be the foundation of our healthcare system. The future of medical care must be the transformed general lifestyle guidance, eat a healthy diet, exercise regularly, that many physicians try to provide to their patients in individualized, tailored lifestyle prescriptions for both prevention and treatment of chronic disease. Lifestyle is the best medicine when applied correctly. And that's key, that's that last one. Oftentimes it's about exercising smarter, not harder. You can go and work out hard, I'm okay with that. It shouldn't be intense 5 or 6 days a week. Intense, light workout, off a day, or light yoga. Intense, light workout, yoga, something like that. That's more like a smarter workout plan. They need to be applied correctly. Otherwise, they can contribute to the things that we're talking about today. Therapeutic lifestyle changes has good evidence base. There's no specific drug treatment for metabolic syndrome. And so if you suspect a challenge, I follow their principles. Stephen Covey says, you must seek first to understand, then to be understood. I first need to understand physiology, understand what's going on, and you guys should too with your physiology, and then start to make changes. Paul Chek says the program is only as good as the assessment. And really the difference is your ladder leaning on the right wall? So you can climb up this ladder of lifestyle and trying to change your diet and change your lifestyle. But if, let's say you're going through a detox program, but yet you have blood sugar abnormalities, you're missing a lot of things that you could be doing right, and you're not going to get the most out of your detox program. If this is a priority and you have metabolic syndrome, your wall should probably lean on this wall, or your ladder should probably lean on this wall. Okay? That's what a good assessment and seeing a health coach can do.